So this is part 2 of pre-discussion section. First one is thyroidectomy, the bleeding back of neck. When the patient having undergoing thyroidectomy, we should check the bleeding back of the neck. The post-thyroidectomy is a compressive neck hematoma is a significant concern for a surgeons because it can cause severe and even life-threatening problems like respiratory distress and airway compression can occur as a result of postoperative bleeding. So should check bleeding on back of neck. So the after thyroidectomy, the patient can develop the hematoma or bleeding uh, from the neck that will compress our respiratory the airway of the respiratory system. So that will lead to respiratory arrest and all. So should check bleeding on back of the neck is very concerned in patient undergoing thyroidectomy. Thyroidectomy complications, the voice changes, sore throat, bleeding and blood clots, adhesion or scar tissue that may require another surgery. Then injury to the esophagus or trachea and respiratory distress will be there. The third one is tetany signs, Chopstick sign and Trosis sign. The both signs are seen in tetany patient with hypocalcemia, but Chopstick signs seen in hypoglycemia also. So we can see the Chopstick sign, hypoglycemia and hypocalcemia. Trosis sign is a blood pressure cuff is inflated to 20 mm of Hg above systolic blood pressure level. The arterial blood flow to the hand is occluded for a 3 to 5 minutes. The carpopedal spasm will be there, the flexion at the wrist and also the flexion at the metacarpophalangeal joint and the extension of the interphalangeal joint and abduction thumbs or fingers is called Troisier sign. Chopstick sign is an indication of tetany in which an unilateral spasm of the oris muscles is initiated by a slight tap over the facial nerve anterior to the external auditory canal. The facial twitching will be present in chopstick sign. The next one is hypocalcemia. In hypocalcemia, the lower level of calcium level, the normal level between 2.1 to 2.6 mmol per liter. The symptoms we can see the patient having hypocalcemia, there is numbness, confusion, or in extreme cases of cardiac arrest will be there. The causes of hypocalcemia we can remember as one of the mnemonics like CHAMP. CHAMP, C is denoting celiac, Crohn's or Crohn's disease. H is hypoparathyroidism and hyperphosphatemia. A is alcoholism, M is malnutrition and malabsorption also will be the, and P is pancreatitis. These are the main causes of the patient having hypocalcemia. Patient getting hypocalcemia. Hypocalcemia treatment, the intravenous calcium supplementation, monitoring under medical supervision, oral calcium supplementation, treatment of underlying causes of hypocalcemia. The preventive measures maintain a diet that is sufficient in fat soluble vitamins like D and dietary calcium, moderate alcohol intake, moderate amount of sun exposure, reduce intake of caffeine, sodium rich foods, acidic foods and all. Next one is thyroid storm. Thyroid storm or thyroid crisis or thyrotoxic crisis. So happen when thyroid gland is releasing a large amount of thyroid hormone in a short amount of time or short period of time. It's a rare complication of hyperthyroidism. So one of the rare complication of hyperthyroidism also. Symptoms we can see the high fever, agitation, delirium, congestive heart failure, loss of consciousness also. Hyperthyroidism and hyperthyroidism, science and management. The hypothyroidism is not produce enough thyroid hormone in our body. They feel fatigue, depressed, hypersensitive to cold, gain weight and develop constipation. Management, we should give added salt to the patient. The hormone replacement therapy like levothyroxine. In hypothyroidism, there is a decreased metabolism of the patient. So, when the patient have a decreased metabolism, the metabolism will be decreasing, that will lead to a weight gain of the patient. and patient become feel fatigue, and also they feel constipation. So one of the important cause is one is iodine deficiency also. So we have to provide iodine salt to the patient, and also we should give levothyroxine to the patient for the purpose of hormonal replacement. Hyperthyroidism increase thyroid hormone. They feel anxious, experience insomnia, get hot, sweaty, and flushed, lose weight without meaning to end, develop heart palpitation. So in this case, hyperthyroidism, there is increase in metabolism of the patient. So the patient can easily lose their weight and increase in the thirst or increase in the appetite of the patient. The management radioactive iodine, when we are giving radioactive iodine, that will destroy or absorbing the overactive thyroid cells. So we can, in order to, we can reduce the thyroid hormone production. And last final method is surgery, that is thyroidectomy. The next is tonsillectomy, indication posture position. In tonsillectomy is a surgical procedure that involves the complete removal of both palatine tonsils from the back of the throat. The indications, first one is infective cause, recurrent tonsillitis, chronic tonsillitis that are unresponsive to medical management and associated with halitosis like bad breath, the persistent sore throat and cervical lymphadenitis. This is the infective cause of or infective indication for the tonsillectomy. The next is obstructive cause, obstructive sleep apnea, adenotonsillar enlargement associated with the cor pulmonale and failure to thrive. Dysphagia is difficulty in swallowing and speech abnormalities like rhinolalia, then others embedded foreign body in tonsils. This is the main indications of tonsillectomy. The posture position, the head should be elevated 30 to 45 degree. The patient should be sit upright in order to prevent aspiration of blood. Because when the patient is aspirating the blood, that will lead to any complications like airway obstruction and all. Diet in tonsillectomy, clear ice liquids, avoid red color drinks. In order to avoid risk of pain and bleeding, prevent discomfort and promote healing, we have to provide ice liquid to the patient. When the patient takes of red colored drinks, there is a chance of misleading of bleeding. So we have to avoid red colored drinks to the patient. Hyperparathyroidism, hypocalcemia. Hyperparathyroidism is a decreased function of the parathyroid gland with, with underproduction of parathyroid hormone. This can lead to low level of calcium in the blood. So the parathyroid hormone is maintaining the normal level of calcium in our blood. So when the patient having hyperparathyroidism, that lead to hypocalcemia. The appendicitis pain, right lower quadrant. The appendicitis is inflammation of appendix. The appendix is a finger-shaped pouch that stick out from the colon on the lower right side of the belly. So pain will felt on the right lower quadrant of the abdomen. This is the vermiform appendix. The appendix rupture, laxatives and enema is contraindicated. When the patient having constipation is common issue or common complaint of patient with the appendicitis. So when the patient is came to the casualty and all, we have to give enema to the patient before rule out the patient having appendicitis. That lead to rupturing of the appendix because taking laxatives or enema to relieve the constipation in order to make hyperactive bowel movement. So the hyperactive bowel movement, the vigorous movement, will lead to the rupturing of the inflamed appendix. When the appendicitis symptoms are present, is not recommended as it may cause the appendix to burst. Appendix pre-operative position, the supine position in order to avoid undue pressure. The pressure will make the appendix burst. MC-Burney's point, rousing sign and rebounding tenderness. Both are used to diagnose appendicitis. The MC-Burney's point is located in the right lower quadrant of the abdomen and is tended to palpation in patient with the appendicitis. The rousing sign means is when we are palpating the left lower quadrant of the abdomen, which causes pain in the right lower quadrant in patient with the appendicitis. Rebounding tenderness is when the pain is temporarily worsened when you suddenly release pressure. When we are applying pressure to the MC Bernice point and we are releasing the hand, the patient can felt pain, severe pain on that area. This is Rousing sign. Pain is elicited in the right lower quadrant when we are palpating left lower quadrant. This is the MC Bernice point. The MC Bernice point is the when we are drawing imaginary line from the umbilicus to anterior superior iliac spine. The 2/3 of that line we can call as MC Bernice point.